When you come to a conference like this one, what is, in your mind, the biggest opportunity? Is it the conversation? Is it the fact that you're involved with multi-stakeholders?
First, we need to celebrate the success of this country. In a few years, this country is a model in the world. If you see what other Western countries are investing in health, a lot of money. You compare with what Emirates is investing, it's like night and day. But if you see the impact they are making here, it's 3-4 times more than what countries providing a lot of money are making. What is the difference? They are using technology, artificial intelligence. In this country, the medical record. In this country, there is zero fake medicine. In this country, everything is connected, and we can even see the life expectancy moving. I think I came here to learn. I came here to say it's exactly what we need in Africa. And this dialogue, this experience sharing is helping us to move programs in Africa.
When we talk about the challenges facing the world today, obviously, one of them is the possibility of another pandemic. How close are we, in your mind, to another pandemic that shuts down the world?
In Africa, we believe that we are close to another pandemic. It's not propaganda. It's based on evidence. In Africa, what I saw from 2022 to 2024, even now in 2025, is a huge increase of outbreaks. Different types of outbreak. Ebola, Marburg, Mpox, and others. From 2022 to 2024, we have an increase of 41%. All epidemiologists know that something is happening. We move from 153 to 230 outbreaks. What it means almost every single day we have a new outbreak. This is what it means. And that one is in the context of climate change, in the context of insecurity, and to make things worse, when you have so many outbreaks, you have mutations of virus, you need more resources. But we see a decrease in terms of resources. It means when you are unable to detect outbreaks because you don't have resources for diagnostics, when you are unable to treat, there are mutations. And we are 100% sure that there is another pandemic coming from Africa.
Tell me how this impacts you when we talk about depletion of resources. What's the shortfall?
It was sudden. It was not expected. Even for Mpox, we got a number of pledges. It was $1.1 billion. When the US and other countries, they decided to cut aid, we just end up by having 60% of what the people made as pledge. It means the response is not ideal. It means we need to look for other sources of funding. Concretely, what it means so many people of Mpox, we cannot diagnose, we cannot treat them, and these people are moving, are going, and this outbreak is moving to other countries. Second, in Africa, we have a shortage of health workers. Around 5 to 6 million health workers. We need more. This is why we started to empower community health workers to bridge the gap. 70% of our community health workers were paid by external resources. It means today we don't have manpower to support the health program. And third, we don't have medicines. I saw, and I was meeting some ministers in many countries, HIV clinics are locked. They don't have access to medicines. I see people moving from some countries to another one, like in Southern Africa. Many people are moving from their countries to South Africa to look for medicines. This is the huge impact of health cuts. We are talking about human beings. Africa CDC believes that with this health cut, we are expecting around 4 million additional deaths per year, 39 million people moving into poverty, and reversing the progress we made for the past 20 years. It's dramatic. We're also looking for new friends and brothers, as we say, like this country, UAE, is open to support Africa. But we are clear as Africa CDC, no one will fill the gap. It's our own responsibility in Africa to start to rethink how to make huge impact with less. It means providing domestic resources, but putting in place accountability and transparency mechanisms.
How do you see the role of the pharmaceutical industry?
Pharma companies, mostly they are private sector. They are coming to invest in Africa. We are calling them to come to invest in Africa. These pharma companies, they have to make profit. It's understandable, and I'm supporting that. But what we have to do for them is to share that there is what we call demand certainty. Then if they will manufacture a product in Africa, we'll buy this product, not for one country, but for the continent. This is why our head of state, they created under Africa CDC leadership, what you call the African Pool Procurement Mechanism. To buy their product, it's volume. More you are buying, less is the price, and everyone is winning.
In your mind, what are the next steps?
The next step for me is to be another dialogue. We are coming to tell you, support our new approach. But we are also coming to tell you, for this approach, what we call the three-pillar strategy, it means more domestic resources, more innovative financing, more blended finance for investment. For these three pillars to be operationalized, we need your understanding. We need also some catalytic funds, because some investors will come from you. We know in Africa that external assistance as it was before, it's gone, it's dead. We are rethinking the health financing in Africa.
Where do you see those funds coming from?
The way we are approaching that, we are open. The first source, and because we need sustainable programs, for us, the first source is domestic resources and innovative finance. Why we are talking about it? We still have in Africa more than 30 countries out of 55 providing less than 5% of their national budget to health. This is not sustainable. You can bring billions of dollars in the system. After 20 years, we'll still talk about the same issue. We need them to start to increase their budget. But while they are doing that, there will be a huge gap. This money will come from a restructuring of the World Bank program. Second, it will come from other traditional partners. We need now to stop wastage of resources. Let me tell you, only by stopping wastage of resources, aligning partners, we are decreasing wastage by 40%. It means when countries they start to provide more funding, when partners are very well aligned, supporting the program, the vision of the government, the plan, we make huge increase on our health indicators. The third one is new partners who are coming to support Africa, like Emirates, on the way we can support this vision with private sector investing in local manufacturing, but also with some support to some countries to deal with issues. I think we are optimistic.
Your Excellency, thank you for joining us here at Abu Dhabi Global Health Week.
Thank you so much for having me.